Good morning, dear students. Hope you all are fine and doing well. Today we are going to discuss about a topic that is viral hepatitis and its prevention. Before going to the topic, we can see what are the objectives of our class. First of all, define hepatitis, analyze the types of hepatitis, explain the stages of viral hepatitis, then differentiate types of hepatitis and its prevention. So, hepatitis, it is a broad term which means inflammation of the hepatocytes or inflammation of the liver. And the most important, most common cause for this hepatitis is the viral cause. And also other causes are bacterial, autoimmune disease, then chemicals or hepatotoxic drugs, then alcoholism. Today we are discussing about the types of viral hepatitis and common transmission, mode of transmission, its incubation period and how can we prevent this viral hepatitis. So, the types of viral hepatitis: hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. Among hepatitis A and hepatitis E, it is fecal-oral route transmission and also it is transmitted by contamination of water and food items, and it is hepatitis A and E are acute and short term diseases, but hepatitis E, when is affected to the pregnant women in the trimester third, it will be fatal. And regarding the hepatitis B, C, D, they are transmitted by body fluids and blood products, and they are chronic in state and also sometime it may be fatal in some patients. Okay. Before going to see each in detail, we can see what are the common features or what are the stages of viral hepatitis. The stages of viral hepatitis are divided into 3 stages: pre-icterus stage, icterus stage and post-icterus stage. Icterus, you know that what is jaundice, yellowish discoloration. So, pre-icterus stage, that is the first stage of viral hepatitis, that is preceding the appearance of jaundice, that is before the symptoms or associated symptoms of jaundice. Some of the features are exhibited by patients who are affected by viral hepatitis, that is flu-like symptoms and GI symptoms. Flu-like symptoms means anorexia, patient having malaise, fatigue, and GI symptoms like anorexia, nausea, vomiting, diarrhea, and started to elevate bilirubin level as well as the hepatic enzyme levels. Then next stage is the icterus stage. Icterus stage is the second stage. Here the patient will started having the symptoms of jaundice and also associated symptoms. The jaundice, you know that yellowish discoloration of the skin, mucous membrane, eye, and also the urine and stool also get stained. Urine will be dark or tea colored and stool will be clay colored, and patient having pruritus and also patient will having decreased symptoms of pre-icteric phase, that is malaise and anorexia, vomiting, diarrhea, etc. will be decreased in this stage. And the next stage is the post-icterus stage. Post-icteric stage is the convalescent stage or recovery stage. In this period, the patient will start to disappear all the jaundice symptoms, that is color and urine stool will return to normal, then enzymes get into normal, but some GI problems that may present or may not be present, and patient get painful events like malaise, fatigueness started to decrease, and also the energy level getting increased during this stage. So, we discussed about the stages of viral hepatitis, that is pre-icterus, icterus stage and post-icterus stage. Pre-icterus means preceding the symptoms of jaundice, icterus means the jaundice symptoms, and the post-icterus means convalescent state, which is after the appearance of jaundice. Next we can see each hepatitis in details. That is, first one is the hepatitis A. Hepatitis A is formerly known as infectious hepatitis, and it is caused by RNA virus of enterovirus family. And most important risk groups are crowded condition, that is who are staying in daycare, then nursing homes, hostel, etc. and those who exposure to poor sanitation, that is slums, mainly slums. And we can see what are the transmission, how this hepatitis is transmitted. I already told that hepatitis A and E are transmitted by fecal-oral route or through contaminated water and food items. So the hepatitis A transmitted mainly by fecal-oral route, then person to person, then parenteral route, and contaminated vegetables and other uncooked shellfish and meats, then contaminated water or milk, then poorly washed utensils. Then we can see what are the incubation and infectious stage or period of hepatitis A. Usually incubation period is from 2 to 6 weeks, and that is within 2 to 6 weeks patient will develop infection symptoms. And during the infectious period, that is the infectious period that is from 2 to 3 weeks before and 1 week after the development of jaundice. Infectious period is from 2 to 3 weeks before and 1 week after the development of jaundice. Then we can see how we are going to diagnose this hepatitis A. Hepatitis A can be diagnosed by antibody hepatitis A virus in the blood. Serological test we are doing in that antibody hepatitis A virus we are detecting, and also immunoglobulin M and G. The elevated level of immunoglobulin M indicates recent infection or patient is still having hepatitis A infection, and it will be present in the blood for 4 to 6 weeks. And immunoglobulin G indicate previous infection of hepatitis A. Then we can see how we can prevent this hepatitis A. All the viral hepatitis can be prevented by strict and frequent hand washing. So the first and important thing in hepatitis, in case of A also, strict hand washing, then stool and needle precautions. We have to take care or cautious while taking stool and also needle who are infected with the patients who are infected with this hepatitis A. Then treatment of municipal water supplies, that is proper chlorination. Then serological screening of food handlers, especially food handlers. Then hepatitis A vaccine, those who are high risk group, we are providing hepatitis A vaccine. And then immunoglobulin, those who are individual exposed to hepatitis A virus and didn't take hepatitis A vaccine, that people we have to take this immunoglobulin hepatitis A immunoglobulin, that should be taken within the incubation period, that is within 2 weeks of exposure we have to take this immunoglobulin. And also we have to give this immunoglobulin hepatitis A vaccine for the household members and sexual contact who the individuals with hepatitis A. And also pre-exposure prophylaxis with immunoglobulin, those who are travelling to the country with poor or uncertain sanitation conditions. Okay, this is regarding hepatitis A. And next we can see hepatitis B. Hepatitis B is non-seasonal and affecting to all the age group, and it is also called serum hepatitis. Okay, this hepatitis B virus is usually found in body fluids and blood products. Okay, then who all are the individuals who are getting this hepatitis B are those who are IV drug users, healthcare professionals, clients undergoing long-term hemodialysis, as well as who need frequent blood transfusion, and also multiple sexual partners. Then we can see how this hepatitis B is transmitted. I told you that it is found in body fluids. So while contact with blood and body fluids, who is infected with hepatitis B virus, there is a high risk of getting this. And other possible transmissions are infected blood products, infected saliva or semen, contaminated needles, sexual contact, parenteral route, that is from during pregnancy from mother to baby, then perinatal period perinatal period, that is during the body and blood and body fluid contact during the birth time or delivery time. This is regarding the transmission of hepatitis B. Next, the incubation period. Incubation period is 6 to 24 weeks. Hepatitis A, we said that it is from 2 to 6 weeks. For hepatitis B, it is the incubation period from 6 to 24 weeks. And the diagnostic mode are serological screening, hepatitis B surface antigen HBsAg we are detecting in the blood that indicates the presence of active infection, and if we are checking this HBsAg hepatitis surface antigen after 6 months, it is also still present in the individual, so it indicates chronic state or patient is in carrier state. And along with that, the presence of antibody hepatitis surface antigen HBsAg against antibody is present in the blood that indicates patient is get immunity from hepatitis B or the patient is recovered from hepatitis B infection. And if the and also one more serological screening, that is hepatitis E antigen, that is hepatitis early antigen is detecting in the blood that indicates the recent infection also. So, the recent infection suggests hepatitis surface antigen as well as hepatitis early antigen. Hepatitis antibody against surface antigen shows that patient gets immunized against hepatitis B virus. Okay. And we can see the prevention. The first and most important thing is strict hand washing, then serological screening, then testing of all pregnant women, then needle precautions, then avoid intimate sexual contact or contact with the body fluids who are infected with hepatitis B, then hepatitis B vaccine. And also immunoglobulin, hepatitis B immunoglobulin for the individuals who exposed to hepatitis B virus and who is not taken hepatitis B vaccine. So that for that people we are giving this hepatitis B immunoglobulins. If the patient does get vaccinated, we have to monitor the titer level or antibody hepatitis S level we have to check, and according to that we have to give immunoglobulin. Then next one is the hepatitis C. In starting we said that hepatitis B, C, D are all blood borne. So hepatitis C is also found in it is not seasonal or year round. It is also seen in any age group, and it is common among IV drug users and also those who need prolonged hemodialysis and who have need recurrent blood transfusion. And the risk factors for the hepatitis C virus is also same as that of hepatitis B virus, that is health professional, hemodialysis, going for hemodialysis, etc. And the incubation period is from 5 to 10 weeks, and the testing modality, if we are checking antibody against hepatitis C viruses in the blood is noted, the patient is infected with hepatitis C virus. Okay. And the prevention is strict hand washing, needle precaution, screening of blood. These are the preventive methods of hepatitis C. Hepatitis B and C virus preventive measures are C. And next one is the hepatitis D. Hepatitis D is common among Mediterranean and Middle Eastern areas, and hepatitis D occurs along with this hepatitis B virus. The hepatitis D cannot be happening alone. It is always along with hepatitis B, and the causes and preventive methods are same as that of hepatitis B virus. If the patient is immunized against hepatitis B, that person, that individual also gets immune against hepatitis D also. And the incubation period may vary from 7 to 8 weeks, and the testing hepatitis antigen, surface antigen, hepatitis D antigen detected in the blood, which indicates or its presence is indicate the patient is infective, and also we can check immunoglobulin M and G for the detection of hepatitis D. And the preventive measures is same that of hepatitis B, that is strict hand washing, contact precaution, blood precaution, serological screening, and vaccine against hepatitis B also gets protect against hepatitis D. And the next one is And the next or last one is the hepatitis C. Hepatitis E is same as that of hepatitis A. That is, it is transmitted by water, contaminated water. This is also transmitted by fecal-oral route. And this hepatitis E is most prevalent in areas where sewage disposal is inadequate or where communal bathing is contaminated. The river is practiced. There is the most risk factors for this hepatitis E, and the risk factors and also the transmission is that same as that of hepatitis A virus. That is for crowded areas and who are eating food and water that is contaminated by hepatitis E virus. And regarding the individual and risk, it's travelers who traveling to the countries where the high incidence of hepatitis C, that is towards the India, Myanmar, Afghanistan, Algeria and Mexico. These countries are high risk of getting this hepatitis E virus, and also hepatitis E get more risk for the food or water that is contaminated by this virus. And the incubation period is 2 to 9 weeks. And the testing is serological testing of hepatitis E virus that include immunoglobulin M and immunoglobulin G. Then prevention is strict hand washing, treatment of water supplies and sanitation measures. This is regarding different viral hepatitis, that is hepatitis A, hepatitis B, C, D and E. Next we can see what are the common complications after getting this hepatitis. That is fulminant hepatitis, that is sudden and acute failure of the hepatic function. Then chronic liver disease, cirrhosis, that's fibrotic changes happening in the liver. And last one is the primary hepatocellular carcinoma. Next we can see what are the home care instructions that we can given to the client who have hepatitis or viral hepatitis. The first one is do hand washing, strict and frequent hand washing to be conducted. Then we have to be cautioned while sharing the utensils, clothes, towels and also bathrooms with this infected individuals. Then the client should not be prepare any food for the family members. Then the client should avoid alcohol as well as over-counter medication, especially hepatotoxic medications like acetaminophen and sedatives. Then the client should take adequate rest and also take adequate rest in between the activity in order to prevent fatigueness. Then they have to take small frequent meals consisting of high carbohydrate and low fat foods, because liver is producing digestive enzyme for the digestion of fat. Then the individuals who infected with viral hepatitis should not donate their blood. Then the client may maintain normal contact with the person, that is they should avoid close contact, that is sexual contact or direct kissing should be avoided, and that can be avoided till the patient is get negative, HBsAg negative. Then the client need to carry medical alert card, as well as they have to report healthcare professionals when they are going for any special procedures like dental procedures, etc. Then they have to keep follow-ups. They have to check every 6 months, that is whether the hepatitis surface antigen is negative or not. This is regarding viral hepatitis and its prevention. So far we discussed about what is hepatitis and what are the different types of viral hepatitis, how this is transmitting, what is the incubation period and what are the preventive methods for each and every viral hepatitis. You can refer the textbooks like Brenner and Siddharth textbook for medical surgical nursing, then Lewis textbook for medical surgical nursing, and also you can check various community medicine books like Park and all for the detailed information regarding the transmission and the preventive methods. Okay, hope you all understand the topic. Okay, thank you.